Just got done with my second dose of antibiotics. So what's been happening, my fistula, the venous site, for about a week, I noticed that it was leaking like this little clear liquid, and it had a smell to it. You know, when things like that happen, you have to let your dialysis team and your doctors know, because that, you know, could be a sign of infection. So anyways, we took some cultures, you know, and some blood work, and came back positive. So right now we're just doing antibiotics to make sure that, you know, this doesn't, you know, get into my system, into my bloodstream. That was something that my nurse and my doctors, my nephrologist, were very concerned about, because if it gets out of control and I become septic, where the debris or infection or whatever it is gets into my bloodstream, that, you know, that can lead to death. So that's why we're taking some heavy doses of antibiotics. I mean, right now it's hard for me to talk because of just how strong that stuff was. But you know, we're clearing all bases. I got to come back tomorrow to do another IV drip. Yeah, there's a little cardinal right there. Always a beautiful sign. But now I'm just gonna go home and take a rest. That antibiotic really took a lot out of me, and I did dialysis yesterday, so I'm gonna go chill out for the rest of the day, get some good food, good vitamins, you know, flowing through my body, minerals, and just rest. Day 3 of antibiotics, and again, this is the protocol that my doctors have chose for me when I mentioned that my top venous site, because I use buttonholes, right, needles, the needles that are not sharp. I stick myself in the same area every time, but you know, there comes a risk with that. You can get it infected, and that's exactly what happened. So my doctor was a little bit nervous and hesitant, because we're scared, because he thought it was MRSA or something like that. And that they were just mentioning to me how in this clinic, I think once or twice a year, a patient gets it, and you know, they don't make it. They die, they pass away, and it's not pretty. So, but you got to cover your own bases as a dialysis patient to make sure that, you know, you're asking questions and you're comfortable with what's going on. Right now, this is a new antibiotic that they're giving me compared to the last couple days. Is called daptomycin. And, you know, I was a little nervous because back when I was younger, they gave me an IV antibiotic called vancomycin. And for the people that don't know, oh my goodness, the reaction to that was crazy. So now, I mean, I'm doing pretty good. I'm doing okay. Hopefully we can, you know, just clear this up, get it over with, and I can go back to using my site normal, the way I've been doing it. Because right now, what I've been doing, I've been sticking down here with a sharp needle, And I mean, for now, that's what we're gonna do because this is the site that I have, and that's just the better way of going about things. But once this clears up, I'm gonna go back to using that area. But this is what we do when we have an infection in our fistula site, and this is the treatment: IV antibiotics getting administered here in my home clinic. And I'm just grateful. I'm grateful that I'm living in America and I have this option, because I know if I was living in Uruguay or Mexico, where my family is from, I wouldn't have this. So be grateful. And about 20 more minutes to go, and then I'm gonna get some good food. Probably gonna treat myself with a little iced coffee, I know, something, and then just go home, relax, and do treatment later on tonight. So yeah, take care of yourself. Remember that. Those antibiotics are no joke. Goodness gracious. Just leaving my home dialysis center. Just did about 30 minutes of an IV drip of antibiotics, and man, I feel it. Like I was telling my nurse in there, before, most of my life, when I was on pain medicines and benzos and all these medications, my body was just so toxic that when I was in the hospital getting antibiotics, heavy doses of antibiotics and pain medicines and all that stuff, I didn't really feel it. But now that I've been working on cleaning my system out and really just being clear, being clean within, in and out, man, ooh, you feel it. The body becomes sensitive, like a sensor, and yeah, I just feel so heavy right now. I feel a little nauseous. I feel like I drank poison. And technically that is what antibiotics are, but it's because it kills everything. That's what its job is to do. After going to the clinic for 1 week to get my IV antibiotics administered by my dialysis RN, they trained me on how I can do this myself at home. So we have 1 bottle of sterile water and then 1 gram of the cefazolin antibiotic vial. We're going to be taking about 2.5 milligrams of the sterile water into a syringe. Make sure to clean it with your alcohol pads, and just make sure you're wearing your mask, gloves. Everything is clean as possible and sterile as it can be. But again, what I'm going to be doing is taking 2.5 sterile saline water Once we have our 2.5 mLs of sterile water, we inject that into the antibiotic vial to dissolve all of the medicine, the powder that's in there. Make sure to give it a good shake, stir, and notice when all the pieces have dissolved. Next on the instruction list is to draw back 5 ml of the sterile water, and with this we're gonna mix the medicine, the antibiotic, and the 2.5 ml that we added before drawing it back into the syringe all together so we can have our medicine for the final phase. And that's all you have to it. Congratulations. You have just drawn up your medication, your IV antibiotic for later in treatment. When we have about 10 minutes left, we will administer the medicine that is inside the 10 cc syringe to our dialysis filter, or what we call the pigtail line, at the end of treatment. When you have 10 minutes left, 1 ml every 3 minutes.